Did you know that for every 10 minutes that pass during a major medical emergency, the chance of a full recovery can drop dramatically? A simple fall, a sudden dizzy spell, a moment of confusion. For many seniors living alone, these aren't just minor incidents. They are potential turning points where the right knowledge can mean the difference between a minor setback and a life-altering event. For decades, emergency rooms have told the same story. So many tragedies could have been lessened, or even averted entirely if only the person, or someone nearby, knew a few simple, crucial steps to take in those first golden minutes. This isn't about fear. This is about empowerment. It's about trading panic for a plan, and helplessness for a set of skills that are as vital as knowing how to lock your front door. The brutal truth is that as we age, our bodies become more vulnerable, but our minds can become our strongest shield. The information we're about to cover isn't just a collection of tips, it's a lifeline. These are the fundamental, science-backed first aid skills every single person over 60 must know. These aren't complex medical procedures. They are simple actions, powerful strategies that can keep you, or a loved one, safe until professional help arrives. So take a deep breath, and let's begin this journey together. What you learn today could very well save a life tomorrow. Let's start with the emergencies that are most time-sensitive, the ones where every single second counts. We're talking about the big three: heart attack, stroke, and choking. Mastering your response to these can fundamentally change the outcome. First, let's revisit the heart attack, because it's so common and so misunderstood. Forget what you've seen in movies. A heart attack isn't always a dramatic clutch of the chest followed by a collapse. For many, especially for women, the signs can be deceptively subtle. It could be a crushing pressure, yes, like an elephant sitting on your chest. But it could also be an ache in your left arm, your jaw, or your back. It could be a sudden, unexplained shortness of breath while you're just sitting in a chair. It could be overwhelming nausea or a cold sweat that breaks out for no reason. The key is this: if you feel something new, something strange and heavy in your chest or upper body, and it doesn't go away, you must act as if it is a heart attack. The biggest mistake people make is waiting. They tell themselves it's just indigestion, or they don't want to be a bother. But your heart muscle is dying with every minute that blood flow is blocked. Time is muscle. The very first, non-negotiable step is to call emergency services. Do not call your neighbor. Do not call your son or daughter who lives 20 minutes away. Call for professional medical help immediately. While you are on the phone with the dispatcher, they will guide you. But there are two things you can do to help yourself. If you are not allergic and have been told by your doctor it's safe for you, chew one full-strength, 325 milligrams, aspirin. Don't swallow it whole. Chewing it gets the medicine into your system much faster. Aspirin thins the blood and can help break up the clot that is causing the heart attack, restoring some blood flow. Think of it as sending in the first wave of firefighters to slow the blaze until the full crew arrives. The second thing is your position. Do not lie down flat, and do not pace around. Pacing puts more strain on your heart. The best position is to sit down, perhaps leaning against a wall or in a sturdy chair, with your knees bent. This reduces the workload on your heart. And finally, before the paramedics arrive, if you have the strength, unlock your front door. It's a small detail that saves them precious time. A locked door can be the final, tragic barrier between you and survival. Remember the story of a 73-year-old widower in Arizona. He called 911 but collapsed before he could get to the door. Paramedics wasted vital minutes forcing their way in. By then, the damage was too severe. Your job is to make it as easy as possible for help to reach you. Now let's talk about the second major emergency, a stroke. A stroke is often called a brain attack, and the principle is the same as a heart attack. Blood flow to a part of the brain is cut off, and brain cells begin to die. Just like with the heart, time is brain. The faster you get treatment, the better the chance of recovery. For strokes, there is a simple and powerful acronym everyone must know: FESD. F stands for face. Ask the person to smile. Does one side of their face droop, looking almost like it's melting? That is a classic sign. A stands for arms. Ask them to raise both arms straight out in front of them. Does one arm drift downwards, or feel too weak to lift? That is another red flag. S stands for speech. Ask the person to repeat a simple sentence, like, "The sky is blue." Is their speech slurred? Are they using the wrong words? Or are they unable to speak at all? And finally, T stands for time. Time to call emergency services immediately. Even if the symptoms seem to improve or go away, you must call for help. Sometimes the symptoms of a mini stroke or TI can resolve, but they are a massive warning sign that a major stroke is imminent. Unlike a heart attack, there is no pill to take at home. The only effective treatment for the most common type of stroke is a clot-busting drug that must be administered by doctors in a hospital. And there is a very narrow window of time, often just a few hours, in which it can be used. Do not give the person anything to eat or drink. Just stay with them, reassure them, and note the time the very first symptom appeared. The paramedics and doctors will need to know this. Your job is to recognize the signs with FEST and get help on the way. The third immediate threat is choking. It's silent, it's terrifying, and it can happen to anyone, but seniors can be at higher risk due to dental issues or difficulty swallowing. You must know the universal sign for choking. A person clutching their throat with one or both hands. If a person is coughing forcefully, let them cough. Their airway is only partially blocked, and coughing is the body's most effective way to clear it. But if the person cannot cough, cannot speak, and cannot breathe, their airway is completely blocked, and you have minutes, if not seconds, to act. You need to perform the Heimlich maneuver, or abdominal thrusts. Stand behind the person. Wrap your arms around their waist. Make a fist with one hand and place the thumb side of your fist just above their belly button, while below the breastbone. Grasp your fist with your other hand and give a quick, upward thrust into their abdomen, as if you're trying to lift them up. Repeat these thrusts until the object is expelled or the person becomes unconscious. But what if you are the one who is choking, and you are all alone? This is a skill every senior who lives independently must know. You can perform the Heimlich on yourself. You can either use your own fist, placing it in the same position above your belly button and delivering a forceful upward thrust, or you can use a piece of furniture. A sturdy chair, a countertop, or a railing works best. Position yourself so the edge of the object is against your abdomen, in that same spot above your navel, and then quickly and forcefully thrust your body downward and forward against it. The pressure from the object acts like the fist in a normal Heimlich maneuver. It can be the one action that saves your own life. Do not hesitate, and do not be gentle. The force required is significant. Moving on from those immediate life or death situations, let's discuss injuries that are incredibly common in the senior community, starting with falls. A fall can be anything from a minor stumble to a catastrophic event. If you encounter someone who has fallen, your first instinct might be to help them up immediately. Resist that urge. First, you must assess the situation. Are they conscious and alert? Can they speak to you clearly? Ask them where they hurt. If they are complaining of severe pain in their head, neck, or back, or if they have lost consciousness at any point, do not move them. Moving someone with a potential spinal injury can cause permanent paralysis. In this case, your only job is to call for help, make them as comfortable as possible without moving them, and perhaps cover them with a blanket to keep them warm. If they are conscious, alert, and not complaining of head, neck, or back pain, you can then assess for other injuries. The most common are bleeding and broken bones. For bleeding, the principle is simple and universal. Apply direct pressure. Take a clean cloth, a towel, a piece of clothing, whatever is available, and press it firmly and directly onto the wound. Hold that pressure. Don't keep lifting it to check if the bleeding has stopped. If the blood soaks through the first cloth, do not remove it. Just add another cloth on top of it and keep pressing. Maintaining steady, direct pressure is the single most effective way to control most types of external bleeding. What if you suspect a broken bone? Signs can include a limb being at an odd angle, severe swelling, or the person being unable to move or put weight on it. Again, do not try to straighten it or set it yourself. Your goal is to immobilize it. Keep the person still and try to support the injured limb in the position you found it. You can use pillows or rolled up towels to prop it up and prevent it from moving. The goal is to minimize movement and pain until medical professionals can take over. The key takeaway with falls is to assess before you act. Don't rush. Check for consciousness, check for head and neck pain, and then address bleeding and potential fractures while you wait for the ambulance you have already called. Another common household injury is a burn. As we get older, our skin becomes thinner and our reaction times may slow, making us more susceptible to burns from cooking, hot water, or heating pads. The first aid for burns is surrounded by myths. Do not put butter, oil, or ice on a burn. These can trap heat in and cause more damage. The correct and only immediate action for a minor to moderate thermal burn is to cool it down with cool, running water. Hold the burned area under the tap for at least 10 to 20 minutes. This does two things. It stops the burning process within the skin, and it provides significant pain relief. After cooling the burn, you can cover it loosely with a clean, dry cloth or a sterile bandage. When should you seek emergency care for a burn? If the burn is very large, bigger than the palm of your hand, if it's on the hands, feet, face, or genitals, or if the skin is blistered, blackened, or looks white and leathery, it requires immediate medical attention. Now let's shift our focus to medical situations that can develop more slowly, but are just as dangerous if not recognized. Many seniors live with diabetes, which means they are at risk for both low and high blood sugar emergencies. Low blood sugar, or hypoglycemia, is the more immediate danger. The brain runs on glucose, and when there isn't enough, it starts to shut down. The signs can look like intoxication, confusion, dizziness, shakiness, sweating, and irritability. If you know someone is diabetic and they are showing these signs, and if they are conscious and able to swallow, you need to give them sugar fast. About 15 grams of a fast-acting carbohydrate is the standard. This could be 4 ounces, half a cup, of juice or regular soda, a tablespoon of honey or sugar, or glucose tablets. The key is to get them sugar quickly to raise their blood glucose levels. If they don't improve in 15 minutes, you should call for help. High blood sugar, or hyperglycemia, develops more slowly, but can lead to a serious condition called diabetic ketoacidosis. The signs are more subtle: extreme thirst, frequent urination, fatigue, and sometimes a fruity smell on the breath. The at-home treatment is to encourage them to drink water, and if they have their insulin and testing kit, to check their levels and follow their doctor's plan. If they seem very ill, are vomiting, or are becoming unresponsive, it is a medical emergency. Let's also consider environmental factors. As we age, our body's ability to regulate its own temperature becomes less efficient. This makes seniors highly vulnerable to both heat stroke and hypothermia. Heat stroke is not just feeling overheated. It's a life-threatening condition where the body's core temperature rises to dangerous levels. A key sign is that the person may stop sweating. Their skin will be hot, red, and dry. They will be confused, dizzy, and may lose consciousness. This is an absolute emergency. Call 911 immediately. While waiting, move the person to a cooler place, loosen their clothing, and try to cool them down by sponging them with cool water or applying cool, wet cloths to their neck, armpits, and groin. Hypothermia is the opposite. It's a dangerous drop in body temperature. It can happen even in a home that feels only slightly cool. The initial signs are shivering and clumsiness. But as it gets worse, the shivering may stop. The person will become very confused, drowsy, and their speech will be slurred. This is a medical emergency. Move them to a warmer place, remove any wet clothing, and cover them with warm blankets. Do not give them alcohol, and do not rub their limbs, as this can cause more problems. Gentle, passive warming, and professional medical care are essential. All of these skills are reactive. They are what you do when an emergency is already happening. But perhaps the most important first aid skill is being proactive. It's about preparation. The single greatest thing you can do to help yourself and any first responder is to have your medical information ready and easily accessible. This is often called a vial of life or a file of life. It's a simple document that you keep on your refrigerator, a place paramedics are trained to look. This document should list your name, date of birth, any major medical conditions you have, like heart disease, COPD, or diabetes, a complete list of all the medications you take, including dosages, any allergies you have, especially to medications, and emergency contact information for your family and your doctors. In an emergency, you may be unable to speak. This piece of paper speaks for you. It gives the paramedics a complete medical history in seconds, allowing them to treat you faster and more effectively. Take the time to create this document. It is one of a senior's most powerful survival tools. Along with this document, every senior should have a well-stocked, senior-friendly first aid kit. This goes beyond just a few bandages. Your kit should include essentials for bleeding control, like sterile gauze pads and medical tape. It should have an instant cold pack for sprains or swelling. But also consider adding items specific to your needs. A magnifying glass to read the tiny print on medication bottles, a pair of tweezers for splinters, antiseptic wipes, and any personal items like a backup glucose meter or blood pressure cuff. Keep this kit in a place that is easy to see and easy to reach, like a kitchen cabinet or a bathroom drawer. Finally, the most powerful tool in any emergency is your telephone. Keep it charged and keep it with you. Program your emergency contacts into your phone and consider adding IC. In case of emergency, in front of their names, a practice recognized by first responders. If you live alone, seriously consider a medical alert system. These devices, often worn as a pendant or a wristband, can connect you to an emergency dispatcher with the push of a button. Even if you can't get to your phone, they provide a layer of security and peace of mind that is invaluable. When you make that call for help, whether on a phone or an alert device, remember to stay on the line. Listen to the dispatcher's instructions. They are trained to keep you calm and tell you exactly what to do until help is standing right beside you. Knowledge, when practiced and prepared for, transforms into wisdom. The skills we've discussed today are not just abstract concepts. They are practical, life-saving actions. From recognizing the subtle signs of a heart attack or stroke, to knowing how to perform the Heimlich on yourself, to the simple act of preparing a medical information sheet. Each one is a layer of protection you build for yourself and for those you care about. A heart attack doesn't give you a second chance to learn. A fall doesn't wait for you to read the manual. An emergency demands that you act. Now you have a plan. You have the knowledge. Your task now is to not let it fade away. Review these steps. Make your vial of life. Build your first aid kit. Talk to your family about your plan. By taking these proactive steps, you are not living in fear of what might happen. You are living with the confidence of knowing you are prepared. Stay safe, stay prepared, and remember that the power to change the outcome of an emergency is, more often than not, already in your hands.